Hi everyone, Dr. Brian Center here at Wilkins Spinal Care with this week's Facebook video. As you can see, I'm not in my usual room that I'm usually talking in. We have a little bit of a different treat for you guys today to give you a little bit more information. As you saw on the Facebook page this week, I talked a lot about disc injuries. Obviously that's what we're going to be talking about. If you have any questions regarding past material, please feel free to send me a message and I'll be able to answer any of those questions for you. So diving into this week's topic with disc injuries, we're going to specifically talk about disc bulges and disc herniations. So I don't have my spine like I usually do, but essentially that disc space, as we talked about in past videos, it's that space in between each bone that allows for small friction type movements. So when getting into disc injuries, what happens is that fluid that's in the disc starts to leak out, putting pressure on that nerve, whether it's in the neck or in the low back. The low back is more common because it's more of a weight-bearing region, but that's when we start to feel pain going down the arms, hands, fingers, and then into the legs, knees, into the feet and toes. Patients tend to have numbness feeling. They start to get weak due because to that nerve not functioning properly. So people who have disc injuries are typically because things that cause it are traumas, obesity is one. There's a lot of different factors. And as you can see, I have a patient with me. She'll talk a little bit about her condition when we get to it. But how do we prevent disc injuries? So obviously you don't want to hurt yourself. Losing weight's a big thing, eating right. All those types of things can prevent those disc injuries. And another big thing is repetitive motions. A really big one that we'll see with patients with neck disc injuries are people who sit at a desk all day in that flex position that I've talked about, and that neck extended out puts pressure on that disc. A big thing is correct posture and correct biomechanical movements. So now let's talk more into what does the chiropractor do. A lot of people get nervous going to a chiropractor for a disc injury, but a lot of studies have shown that a chiropractor is actually very beneficial in the disc injuries. Here at Wilkins Spinal Care, we actually have high-tech non-surgical spinal decompression that we've had for about 15 years or so, and a lot of patients have found great relief. Patients who have had failed back surgeries, who have those symptoms going down the legs, down the arms, they seem to lose those feelings and they get that pain-free life back, and that's what we try to do here. What we do is we set you up in the room as a new patient and we talk about your condition and we kind of determine, are you more of a chiropractic patient or are you more of a spinal decompression patient? And obviously patients who are under spinal decompression also get chiropractic care to help supplement with their treatment plan. So non-surgical decompression is different than spinal traction. Spinal traction just keeps pulling. This non-surgical spinal decompression has that pumping mechanism that I've talked about in the past that helps rehydrate that disc. But that's a little bit about the spinal decompression. If you have more questions on that, feel free to send me a message on that, and I'll be happy to answer those questions. But here we have Miss Janice. Miss Janice will talk just a quick brief about her condition. She had a workers' comp case back in December that left her with a disc herniation L5, L1, and T12. She just wants to talk real quick about her condition, how she's done with the spinal decompression therapy. She'll go ahead and do that real quick.
When they first started the spinal decompression, I was not able to lift my legs. They had to do that for me to put this wedge under, and I can now do that. And I've also had a difficult time getting on and off the table, which now I can step on easily. So the pain is dramatically increased, or decreased, I'm sorry, not increased.
So it definitely is a long road for her, but in the time that I've been seeing her and the time that she had that injury, she has been doing a lot better with her care. Down the road I'll do more of these videos, but that's all I have for you guys this week. Next week we're going to gear our material more towards neuropathy now, another thing that we focus here at Wilkins Spinal Care. And I'll probably try and do the same thing that I'm doing with Janice here and try and find a patient who's willing to let me video them as well. But if not, I'll just do like a video like I usually do. This week it will be on, next week will be on Wednesday, and I know this week was Thursday. We just wanted to get Janice in here. But that's all I have for you guys today. If you have any questions, feel free to send me a message. Have a good day.